lot of my work then and it originated through public health. So the company, is innovation development using public health methodologies. And through that work is being able to foster an idea and make it tangible and get the proper resources to make it grow. That's a powerful thing. But if an entire team knew their role in terms of how to do that so that innovation can be facilitated at a faster rate, and that's an even more powerful thing. That's why Google and Facebook pay all the big bucks for all those very bright and talented people, is so that they can foster a culture, a workplace of innovation to develop more and more and more innovative solutions to make them bigger and better and pockets more fatter. But like I mentioned, public health innovation is there. A lot of people don't talk about it, but it's there, and I think it's the thing that's going to lead us into this next decade, because coming into this decade, we was faced with a public health crisis, and we found out that technology helped us through that. But I think if we really put a focus, just like the same focus we did through COVID, and we kept that focus up and developed more and more public health innovation, I think the world would be honestly, I think we could probably solve a lot of our chronic illnesses through public health innovation in the next 10 years. It's just something that people, I'm not too sure what it is. A lot of public health institutions are very traditional. They want to do it the traditional ways, the traditional practices of public health, and that's fine. But, I think we've realized in the last couple of years that traditional is cool, but we need to be innovative. We need to get ahead of this thing and have strategies for prevention so that it doesn't happen the way it happens again. And again, that talent is being able to provide a team of people with the understanding of how to conduct and develop innovation. That's something that we can foster in terms of public health innovation and help move the needle forward. Because that's the thing about it too, public health innovation. When I first started talking about it, I was in school, but now it's actually becoming a thing. There's one of my teachers that his name is Dr. Terry Hung. He's out at New York University now, and he leads public health innovation there. So I know it's going to be a big thing. But all that to say, with public health innovation, there is a lot of opportunity in being able to train our next public health workforce on how to practice public health that's tangible and effective while using technology to get it done. And not only gives us an opportunity to improve our systems and how we provide solutions to the community, but it also helps improve our bottom line as we go back to that, that budget. Because one of the things in terms of public health right now is very little bitty things that we can make money off of. And there's guys out these days like Facebook, that's collecting a lot of data. They're affecting public health. There's been research showing that social media has impact on mental health. If we took that same type of innovation, had a team of innovation, just like Facebook, start going out and really understanding the needs and understanding innovation and types of things that we could do, and softwares that we can build, like just the new and innovative things we can introduce to the world of public health, being able to shape the future and change the game. I think we could develop technology just as effective that can affect people internationally, figuring out different ways we can, practice public health innovation in bigger ways that we can do it, and more people we can work with so that we could, really build the future.